Well, good afternoon and welcome to Kaweah Delta's bi-weekly webinar. My name is Deborah Volleson and I'm the Director of Community Engagement for Kaweah Delta. Today is Thursday, March 25th, and I'm joined once again by Gary Herbst, our hospital CEO. We're going to cover the questions that you sent in, and we're going to also be paying attention to our emails and our chat lines. But before we jump into the segment, I just want to remind you all that I sent an email a couple of days ago inviting you to participate in a sneak peek of our emergency department. On Monday, April 12th, we are going to be offering tours to our community engagement members, and so those will be running from 11 to 1:30 in 30-minute increments. So go ahead and email me and I will plug you into a tour. It's a beautiful facility and we're on target to open for patient care on April 19th. So this will give you a great opportunity to come in before everybody else. So good afternoon, Gary, and welcome to the webinar.
Yeah, thanks, Deb.
A lot has happened since our last virtual
It has,
meeting.
and I was just commenting to you, I can't believe it was only 2 weeks ago. For some reason, the last 2 weeks just feel like a blur.
Yeah.
But yeah, it's good to be back, and we might have to think about moving our studios outside because it is absolutely gorgeous.
It is,
out there right now. And I was looking at the paper this morning, and we're supposed to hit 80 degrees, I think, by Sunday. So definitely spring has arrived, and hopefully that with this warmer weather, we continue to see fantastic COVID improvement and see this virus start dying off. And definitely we'll start seeing the flu completely subside. And so a lot of positive things to report on.
Yeah, last time we were here, it was the day before our 1-year commemoration of the anniversary of COVID hitting our halls. And so that was a really great day. Also filled with a little bit of emotion because our teams have really gone through a lot in the last 12 months. But we've also, since then, we've revisited our visitor policy and we've made some changes. And so exciting things.
Yeah,
and I know
I have pretty much nothing but positive news to report today. So yeah, we might want to frame this particular week's community huddle.
Wonderful.
Yeah.
Wonderful. All right, let's jump in.
All right, so I'll move through the numbers quickly, starting at the state level, and just to put things in perspective, the state of California population now stands at 39.98 million people. So we are just barely shy now of having a population of 40 million people in the state of California. We have conducted statewide 52.8 million COVID-19 tests, of which 3.6 million Californians have tested positive for the virus. So that translates into a cumulative positivity rate since a little more than a year ago of 6.7%. But that number has been plummeting over the last few weeks, and the state just reported yesterday that the 7-day positivity rate, so the positivity rate of cases that are being tested over these last 7 days has now dropped to 1.9%, which is the lowest level that we've seen in more than a year. The number of new daily cases per 100,000 population also is continuing to come down, and the state's reporting that over the last 7 days statewide, we're now down to 5.1 daily new cases per 100,000 population. On a sad note, obviously this is where the numbers have gotten bigger at a time when it's really heavy on our hearts, and that's the number of COVID-related deaths. So we are now at 56,850 statewide, which translates into 142 deaths per 100,000 population. So obviously significantly above the roughly 20 deaths per 100,000 that we see from flu-like hospitalizations and deaths each year. What's held very steady is the percentage of those that contract the virus that do end up passing away from it. That number has really remained at 1.6%, almost throughout the entire pandemic. So that should sound like a very familiar number to you. As of today, statewide, we have 2,826 patients that are currently hospitalized because of a COVID-related condition. But only 702 of them, a little less than a quarter, are in the ICU. So again, that number has stayed pretty consistently in the 20% range. It's tend to be higher, 28 even to 30%. So, but it's still down at 25%. So still kind of pretty consistent there. There have now been 16 million doses of COVID-19 virus or vaccinations that have been given statewide. And there are now, I'll give you the rundown, the governor's blueprint for a safer economy. Remember the 4 different tiers that all of the counties are placed in. So 58 counties statewide, and you are placed in one of these 4 tiers depending on your COVID metrics over a 7 to 14 day period. So as the state has seen significant improvement up and down, north to south and east to west, we've also seen pretty remarkable shifts, improvements on a county level. So there are only 8 counties that still remain in the purple tier 1, Fresno County being one of them, just to the north of us, but they fully expect that they're going to move into the red tier 2 by next Tuesday when the state announces their weekly metrics. There are now 39 counties that have moved into red tier 2, Tulare County being one of them, and we're very excited to be in that red tier. There are 9 counties that are in orange tier 3, and 2 counties that are in yellow tier 4. I think 2 weeks ago we talked about Alpine County up north by Sacramento, less than 2,000 population, but they had been in yellow tier 4 for some period of time. So that's where we are on the state level. Now moving to the county level, and this is where I'm kind of winging it a little bit. I've had a pretty intense morning, so I didn't get to pull together all of my typical notes. So I'm going to be reporting from the county's daily COVID-19 situation report, which is it's a great document. It does a phenomenal job of just kind of giving you a real comprehensive sense of what's going on in the county from a COVID standpoint. So in Tulare County, countywide now, we have performed just shy of 471,000 COVID-19 tests. There have been 48,878 people that have tested positive for the virus. Sadly, there have now been 801 deaths. So we did eclipse that 800 number. 192 of them do relate to nursing home residents, and that number has held pretty steady now for several months. So really good to see that the nursing homes seem to have really got their hands around effectively keeping their residents safe and their staff safe. There are now only 558 active COVID cases throughout the county that the county health department is monitoring. On a very positive note, again, there are 3 metrics. The overall positivity rate for the county in terms of the total number of tests being done, again, over a 7-day period, what percentage are testing positive. And then also for a positivity rate of those folks that live in some of the poorest area of the county and have less access to health care and just other social determinants of health are really challenging for them. So that's called the health equity positivity metric. And then that last one is the number of daily new cases per 100,000 population. So Tulare County now, the overall positivity rate has now fallen to just 3%. So we're still higher than the state's 1.9%, but that 3% now moves us into the orange tier. Well, we're not moving there yet, But if that was the only metric, we would actually qualify to be in orange tier 3. To get to yellow tier 4, that positivity rate has to fall below 2%. So getting very close to it at 3%. Likewise, our health equity positivity rate has come down to 4.3%. And again, to move out of purple, you need to be below 8%. But at 4.3%, we actually have moved that metric as well, all the way to the orange tier 3. To get to yellow tier 4, that health equity positivity rate has to be below 2.2%. So at 4.3, we're about double that number. So probably the most important to us right now, which is the one that really is keeping us from moving into the next metric, and that seems to be true of all counties. It's really the average number of new cases, COVID cases per day per 100,000 population. So we're at 6.3 right now. And to move from purple to red, initially you had to be below 7. Then the governor changed that when he hit 2 million doses administered to those poor regions throughout California. That moved to 10 or less than 10 per 100,000. So at 6.3, we qualify to be in the red category, and that's why last Wednesday we effectively moved into the red tier 2. To move into orange tier 3, again, you're put in the category that reflects your worst performing metric. So for us, it's that average number of daily new cases. So there are changes that are occurring there as well, and I had my notes here, and this is where I'm scrambling a bit. Shoot.
We could play some music.
Yeah. Maybe I don't have it with. Oh no, yes I do. Okay, it's right in front of me. So to move into tier 3, moderate orange, you have to be below 4 cases. So 3.9 or below per 100,000 people, and we're at 6.3. However, and that's why it starts getting more complex. The governor keeps throwing out different nuances to it. I mentioned the 2 million doses to the more impoverished, less healthy areas. We now have a goal of reaching 4 million doses, and we're sitting right now at 3 million doses have been administered in those poorest communities. Once we hit 4 million doses, then that metric will now move to below 6. So instead of below 4, 3.9 per 100,000 population, it will rise to 5.9 or below, and we're currently at 6.3. So as soon as the state hits 4 million doses administered to those healthy places, areas throughout the state, when that happens, then that metric will move to 5.9 or below, and we're sitting at 6.3, so we're right on the cusp. So somebody asked me one of the questions, when do you think we will move out of red into orange tier 3? And I would say this would be difficult for me, difficult for me to predict, although Deb likes to pin me down, but we're there for the 2 metrics, the 2 positivity metrics, we're already there. And now we're rooting for the state to administer 1 million more doses in those difficult areas, bringing that to 4 million. And then that threshold is 5.9 and we're at 6.3. And that number appears to be dropping every week. I think Doug Leeper reported yesterday we only had 24 new daily cases. And at 24, that would be very close to 5 daily cases. So now that's just one day, but that 5 would be below the 5.9 threshold. So we might get there in a couple weeks. And maybe I'll wait. I was going to share with you what that will mean to us. So I'll wait. I'll stay on the stats.
So I have
unless
a question.
You want me to do that now.
You said Fresno is still in purple.
Yes, they are.
Yet they're wide open.
I know they are. Well, and we know there have been elements of Tulare County that have been wide open. There's really the sheriff and the police departments and even the state, indicated they weren't going to enforce. That's obviously not the job of our
Right.
police department and our sheriff's department, and I understand that. I think if they saw flagrant, egregious violations right in front of them, that they would be compelled to do something, but they're not out, enforcing. So
Yeah.
yeah.
Because the day we hit red, I was like, I've been hitting up restaurants, I've been ready to eat inside, and we still
Yeah.
have a lot of places that are not doing that.
Yeah, my mother and father-in-law were in town last weekend, and my father-in-law just loves Canton Chinese
Oh,
food.
yes.
And so we went to pick it up, and the restaurant's completely closed on the inside. You can take out only. So
Yeah.
they're not ready yet. But that was Saturday, and we just went red Wednesday.
Right.
So
Well, I thought everybody
we
would
get-
be like the lifestyle
like they were
center.
poised. Just yeah, exactly. And then lastly, at the county level, they now have administered a little over 93,000 vaccines or doses of vaccines, so at least one. And they have received a total of 129,000 doses. So still have more than 30,000 doses to be administered. And hot off the press, Tulare County Health and Human Services just issued a press release today that effective immediately, Tulare County is now vaccinating anyone over age 50. So they have now dropped it from 65 all the way down to 50, no matter what your occupation, what industry you work in. Their press release, I'm certain it'll be in the probably their online website, and I'm sure the media will pick this up, but just mentioning that the Tulare County Mass Vaccination Clinic at the Ag Center, calling your local doctor. Lots of pharmacies throughout Tulare County are now providing vaccine, and then going on to the My Turn website and scheduling an appointment with one of almost 30 approved vaccinators, including Kaweah Delta. So we will now, on Court Street at our Urgent Care Center, will now start vaccinating people over 50. So that's very exciting.
That is, yeah.
And then lastly, at Kaweah Delta, so we continue to be still a very busy hospital. We're at 90% occupancy this morning in the acute medical center. We only had 9 medical surgical beds that were open. Almost every single unit was full. What's interesting, of the 36 total beds that we had open this morning, 27 of them were critical care beds. So the availability of ICU beds and ICCU beds has improved dramatically as Kaweah Delta starts coming back to some of its normal operations. In large part because we only have 25 COVID inpatients in the acute medical center right now, and only 4 of them are in the ICU. They're all on vents. We do have 1 suspected COVID patient that is in the emergency department right now. But that number continues to decline. Last week we were hovering around 35, and to be at 25 today is just phenomenal news. And it's allowed us to fully bring back surgery and all inpatient and outpatient procedures. And Deb made reference to our visitation policy. So on Tuesday, March 23rd, we activated a new visitor policy that now allows 1 visitor to come in and visit pretty much all day from 10 a.m. to 9 p.m. continuous with their loved one. And these are non-isolation patients. So if a patient's in isolation because of COVID, they still are not allowed visitation except in rare circumstances. You still have to be screened when you come in. You still have to wear a surgical mask, and you have to wear that throughout your entire visitation with your loved one. We also now, for the first time, are allowing a visitor to go back into the emergency department. with their loved one. So once the patient is taken back into an exam room, then a visitor can come back and stay with them that entire time. So that's a true blessing for our staff and our visitors. And then also with respect to surgery. So if your loved one is having surgery, you're now permitted to go back into the preoperative area and be with them until they're taken to surgery. Once they're in surgery, you do have to wait outside the hospital, but as soon as they're done with surgery, then you're allowed to come in and be brought back to the post-operative area. And then if they go up to an inpatient bed, then you're allowed to visit during that, again, 10 a.m. to 9 p.m. Time frame. So very, very positive news. And then the last thing is our employees. So we've had 1,162 employees have contracted the virus over this 1-year period, and only 23 of them are still out on a COVID-related leave of absence. No employees now are hospitalized with COVID, so very exciting to hear that. And we don't have any of our providers, no physicians or nurse practitioners, physician assistants. Everybody's back to work and nobody is quarantined at home. So
we had a patient celebration for one of our employees on Friday that had been in here for a couple of months, I believe.
I think since
So
December.
that was like a huge celebration for our team.
Yes, it was.
Wow. Let's go back to the visitors. Does that change the unique visitor? We've used that the whole time.
Yes, it does. So it can be a different visitor every day.
Okay.
Yeah, only the same visitor throughout the day because of the screening and everything. So that 10 to 9 p.m., we'd like that to be, the same person. But the next day, it could be a completely different person that following day. Yes.
Okay, well, fabulous. And changes are coming. More changes are coming.
Yeah, I think, again, it's so fluid. We follow the CDC's recommendations. We pay close attention to, the transmission rate from the widespread to, the substantial, moderate, minimal, the 4 tiers. And so I suspect that when we move into orange, that there'll be even further loosening of the visitation policy.
All right, that's great. Okay, so let's jump into the questions. One of our community members' wife is an RN, and she would like to try to get the Johnson & Johnson vaccine. Are we giving that here at Kaweah Delta? Do we have it, first of all, and are we administering it?
Yeah, I don't think we have it yet. So obviously the big difference with the Johnson & Johnson vaccine is a single dose. And that's the entire vaccination process is one dose, whereas Pfizer and Moderna are both 2 doses, and Pfizer you have to wait 21 days between doses, and Moderna 28 days. The Johnson & Johnson vaccine with that single dose, makes it very appealing for a certain population that we would really like to begin vaccinating. Again, I don't know if we actually have received any of the Johnson & Johnson. I believe that the county has, and in fact, our street medicine program partnered with the Tulare County Health and Human Services Agency a couple weeks ago using the county's Johnson & Johnson vaccine to go out and vaccinate the homeless population. Because just logistically, it'd be very difficult to have to administer 2 doses just to track them, to make certain that they got that second dose on time. So the J&J vaccine is perfect for that population. It's also perfect for vaccinating our inpatients that are going to be discharged to a nursing home. So because once they leave here, it's pretty hard to then follow them. So any nursing home bound patient of ours, we'd like to give them that J&J vaccine. Same with our mental health patients when they're discharged from our acute mental health hospital, also our acute rehabilitation hospital. So any of those three populations of patients where once they leave the hospital, it's kind of hard to control that. We'd like to make that available to them, as well as our patients that come for chronic dialysis or radiation therapy. So that's kind of our goal. Our objective is to really target those populations right now and not really making it available to the general public. I think what we're vaccinating folks with over on Court Street is really, again, Pfizer and Moderna. I think at some point, as that vaccine becomes more available, the Johnson & Johnson, and there's really no limit to it, then I think we would like to roll it out into our rural health clinics and then possibly to the urgent care center as well.
Okay. All right. Thank you. So we've had several months to sit back and observe the side effects from these vaccines. So has anyone died or become severely ill after they've received the vaccine, either Moderna, Pfizer?
I am aware of 2 deaths that occurred at Kaweah Delta, not from the vaccine, not when you say side effects of the vaccine or dying from the vaccine. I have not seen that. In the 2 deaths that we experienced, both of those patients had had their first dose, and I don't know if it was Pfizer or Moderna. One of the patients had actually had their second dose, but at the time that they received their second dose, they were symptomatic and appeared to have the virus before they got their second dose. And then they were admitted somewhere 5 to 7 days to the hospital after receiving that second dose. But all indications, because of their exhibited symptoms, they actually had contracted the virus, and they may have had it before the first dose. I don't know if they were asymptomatic or symptomatic before the first dose, but they were symptomatic before they received their second dose. The second patient that died had received their first dose, but became hospitalized with COVID before they received their second dose. So, so both these patients died of COVID, not of the vaccination, not of the vaccine. But in both cases, neither of them had fully completed the vaccination process. So, you know, all the science that's been revealed to us by Pfizer and Moderna is for you to be fully protected, to have that full immunity and that protection, 94 to 95%. And again, really it's 94 to 95% preventing death from the virus or severe illness where you're likely to be hospitalized and on a ventilator. You have to have both doses, and you have to be 2 weeks out from that second dose before they believe that you have that full protection, that full immunity. So neither of these patients had that at the time. And again, even 94 to 95% effective still means that there's 5 to 6% of the population that could still die from it. It's not 100%. It's still incredibly high, and that's why I'm a strong advocate for being vaccinated, because I've never seen a vaccine that has such a high efficacy as these two. But sadly, these patients did die of COVID.
Okay, so I'll rephrase that then. So, and that's very disappointing because we talked a couple of months ago about how some statistics had come out that first dose was so effective that they really thought the protection was very strong after that first dose.
Yeah, no, and you're right. So I believe what I had read about the Pfizer vaccine is their studies indicated somewhere around 57% effective after the first dose of, again, preventing death or that severe illness from COVID. So that's still very high.
Right,
In fact,
right.
is probably similar to the flu vaccine every year, just that effectiveness.
Right.
And again, you know, if you, even with the full vaccination, it doesn't mean that you won't end up in the hospital. You could still contract the virus, we've said that repeatedly, and you could be hospitalized. It's just that you're unlikely to die or to be intubated if you've gone through the full vaccination process. I have read that in the United Kingdom and other places in Europe, that they're considering, even with the Pfizer and Moderna vaccines, to only give one dose, because that way they can vaccinate so many more people with the limited amount of vaccine that we have, and still provide you know, a pretty high level of protection and immunity. But it's not the highest, and so you still have, at 57%, you still have a 43% risk that you could die or end up severely ill.
Okay, so what about people who are getting severely ill? So take out the death. So are we seeing a lot of hospitalizations due to people getting severely ill after the vaccine?
You know, we're not actually tracking that.
Okay.
Again, we only have 25 COVID positive patients in the hospital right now. I don't know how many have been vaccinated or not. So we're really not tracking that. I think that would be an interesting you know, study for us to do. I mean, obviously we're not scientists. I would imagine that there are studies going on right now, maybe being conducted by Pfizer and Moderna or at the state or national level, but we haven't been tracking that ourselves.
Okay. So speaking of tracking, and I'm going to throw one at you here, vaccination passports. Have you heard about that? Somebody was asking me if we thought that was going to happen.
Yeah, I just read an article yesterday about it. I can't remember entirely the contents of it, but I did hear it's kind of controversial. There's folks that support it and folks that don't. So I'm going to reserve or withhold my opinion.
Yeah,
right
I
now.
told my husband, save that little card just in case we have to prove it at any time. Okay, so we reopened our lifestyle center last Wednesday. That was extremely exciting, and that was kind of just a real boost of energy for our staff. How did that go?
I think, according to Patrick Tazio and JAG, I think it went phenomenal. I myself, sadly, I haven't had a chance to get out there yet. I had hoped to this week, but it's already Thursday, and I have to confess, I haven't made it yet, maybe tomorrow. But yeah, it's gone really well. We're limited in the red tier to only 10%. It originally was 25% capacity when we reopened way back when, and then had to shut down almost immediately. But in the red tier, it's limited to 10%, but it's a 55,000 square foot building. So that 10% is measured on square footage.
Oh.
And so that means 5,500 square feet of our space can be used. So they're probably not using the basketball courts. The daycare is still closed. The cafeteria is closed. So we want to use our 5,500 square feet for where our workout equipment is.
Right.
And so that has pretty much allowed us to open up all of the weightlifting and exercise machines and the treadmills and gauntlets, and I want to commend our members, Lifestyle Center members. They're doing a fabulous job of being screened when they enter the facility, and we have this really slick, high-tech machine that takes your temperature. So it helps, move people through pretty quickly. But folks they're socially distancing, they're disinfecting, wiping down equipment. Our staff are wiping down equipment constantly. And folks are wearing their masks throughout when they're exercising. Now, I did ask Jag, and I might have even spoke about this a couple weeks ago. Jag's an avid runner, run a number of marathons, and so he was kind of testing what it was like to wear a mask while he was running on the treadmill. And he said it was really, really difficult. The mask coming down all the time, sweating, breathing your own carbon dioxide. And so when you're exercising aerobically, we're not enforcing the mask wearing as tightly. We are allowing people to kind of pull their masks down so they can breathe. But we are, again, we're spread 6 feet apart and everything. And once they come off that aerobic exercise, that mask comes back on. If you're lifting weights or on one of the machines, you wear your mask. When you're walking around, you wear your mask. But we're being a little bit more lenient if you're doing that heavy aerobic exercise.
Okay, so we've gone rogue again, Gary, so that's good.
No.
So if you're just going to sit on a bike, you need to wave your arms around so that it's aerobic activity.
Yeah.
No, I'm kidding. Okay, well, that's exciting, and I'm sure our lifestyle staff were so excited to come back because they have been not working there.
Right.
What, since June and July?
They have, and I am blessed the Lifestyle Center staff because they were one of the areas that was most impacted.
Yeah.
But so many of them volunteered, took jobs in other locations throughout Kaweah Delta. They became many of our screeners, coming into the hospital or a dialysis center. You see they were there in their Lifestyle Center jackets and shirts. And so just want to thank all of them for sticking with it and continuing to. Irma, she was working in the ED tents. And so just want to thank all of them, and I'm sure they're excited to be back.
And one of the personal trainers became a graphic designer with our marketing department. So yeah.
Is that right?
Very exciting.
Okay, wow.
Okay, so you were going to share with us, one of the questions was they wanted you to predict when we were going to get out of the red tier. So you were going to share, let's just dream a little bit about when we move into yellow.
Right.
So what will we get to do?
Okay, so
hopefully in a couple of weeks.
So all retail outlets get to move from 50% open capacity indoors to 100%. So they still have to have modifications in place and will still require mask wearing and so forth, but they can go to 100% capacity. Museums, zoos, and aquariums get to move from 25% capacity to 50% capacity. Churches get to also move from 25% capacity to 50% capacity, and that's indoors. Movie theaters move from 25% to 50% or 200 people, whichever is fewer. Hotels and lodging get to open their fitness centers with 25% occupancy, and they get to open their indoor pools. Gyms and fitness centers get to move from 10% capacity to 25% capacity, and they also get to open their indoor pools. Restaurants get to move from indoor dining of 25% occupancy to 50% occupancy, or 200 people, whichever is fewer. Wineries, breweries, and distilleries now get to open indoors. So under red, it's outdoors only, but under orange, they get to move to indoors at 25% capacity or 100 fewer people. I know Kelsey is excited about that, being the wine aficionado that she is. Bars, so bars that don't serve food, that they're just bars, they are closed under red tier 2, although we're aware that, yes, technically they're supposed to be closed, but they now get to open outdoors with modifications if they're in orange tier 3. Bowling alleys finally get to open. But with 25% capacity, so bowling alleys have been closed. Kart racing, mini golf, and batting cages are allowed under red, but bowling alleys have had to been closed. Outdoor live events, so football stadiums, baseball stadiums, things of that nature. Under the current Tier 2 red, they can play, but they can have no live audiences. And we're talking California, because I've watched some NFL games where there are definitely fans in the stands, but not in California. So moving to orange now allows live audiences. Capacity has to be limited to 20%, reservations required, assigned seating only. But that's up until April 1st, which is next week. Do we hit April 1st?
Yeah, next
Yeah.
Thursday.
So on April 1st, if we are in the orange category, which we won't be by then, but hopefully shortly after that, then those outdoor live events can have 33% capacity, 25% in the private suites. And interestingly, right now, before April 1st, you have to live within 120 miles of that stadium to attend. So it's for regional audiences only. So you could not go to a 49er game right now because we live more than 120 miles away. But on April 1st, that changes to in-state visitors. So as long as you live in the state of California, you can go to any stadium or live event throughout. So this is sports and live performances. So also concerts.
Concerts
So
will come back.
outdoor concert. They have to be outdoors. All of these events. So I don't think like you can go to a basketball game that's played indoors in an arena. So I don't think they can have live fans yet. So those are the big changes. Very
Gives us
excited
something
about that.
to dream about.
Yeah, exactly.
Yeah, all of my friends who have kids in high school, they still can't go watch them play, even though it's outdoors. Can't go watch
Unless
them
you
play
go to
baseball.
CBC, the private schools.
Yes, you can for those. But
Yeah.
so hopefully that we will move into that before the season's over,
Yeah,
since it
exactly.
just started. Okay, here's a question near and dear to my heart. When do you think we will stop wearing masks?
Yeah, great question. Feels like never, huh? So nobody is coming out and saying that definitively. Everybody is definitely hedging, qualifying their predictions. Some states, Montana, Iowa, North Dakota, Mississippi, and Texas, have actually all rescinded their mandatory mask requirement. So if you live in one of those states, you don't have to wear a mask. Certainly people are choosing to still wear masks,
Right.
but it's no longer mandated. That's not the case for California. The CDC still is recommending that anybody older than age 2 should continue to wear a mask. And pretty much everything I read, every scientist that I researched and looked at their predictions, is they all say it can only really occur until this pandemic's over. And the pandemic being over, defined as we've achieved herd immunity, whether that's at the county level, a regional level, or a state level. And herd immunity means a majority of a population is immune to an infectious disease, providing indirect protection to those who are not immune to the disease, such as newborns or vulnerable people who cannot get vaccinated due to health risks. Generally, originally they were talking herd immunity at 60%, 65% that had natural immunity from having contracted the virus and survived it, or had been vaccinated. We now hear that it might be more like 70 to 80, maybe even 85% that have achieved immunity before it's considered herd immunity, and the unvaccinated population is now safe from contracting it or becoming severely ill. So Dr. Fauci, who speaks often on COVID matters, he recently told CNN that it's possible that public health officials will continue to recommend masks into 2022. However, he said life should look more normal by then, adding, "We're going to have a significant degree of normality beyond the terrible burden that all of us have been through over the last year." So we're feeling that normalcy now. I mean, as we move through the tier, Californians, Tulare County residents are feeling, a bit more normal. But we're all still wearing masks, and it sounds like we may still be wearing masks even into 2022, which is disappointing. but that might be our reality.
Okay, so COVID testing, are we still seeing a high demand for COVID testing at our collection site?
Yeah, it's still high, but it's declining pretty rapidly,
Okay.
no doubt about it. So I just went back. December still stands as the all-time high month throughout the entire pandemic, when we did about 23,000 COVID tests, and 20% of them came back positive. So a far cry from our 3-point-something positivity rate now. And then January, we did roughly 21,000 COVID tests, and still at about 19%, still were coming back positive. February, that fell to 15,000 tests. Now, obviously, we have 28 days in February, and we had 31 in December and January, but fell to 15,000, and only 13% were positive, still way higher than we could be to be in a red tier. And then through March, as of yesterday, which was March 24th, I think it was, we've only done 9,000 tests, and 7% of them were positive. So definitely the attention has turned to vaccinations. So that's really what people are searching for right now. Still doing thousands of COVID positive tests, but definitely, and even Kaweah Delta kind of pivoting our staff and our time and attention to now trying to vaccinate as many people as we can, as opposed to, being the COVID testing center for the county.
Right. Okay, well, it was great news today, Gary, so thank you for that. And we want to thank everybody for joining us for this webinar. I want to remind you, I made the announcement at the beginning, but I want to remind you again, if you would like a sneak peek of the emergency department, we are having little 30-minute tours on Monday, April 12th. And we have an RSVP chart that we're going by. Our ED leadership team is going to be leading those tours and giving you all of the information. And then we hope to open that to patient care on April 19th. So this is a really good opportunity for you to get to come in, and it's going to be beautiful. And it will be pristine and ready for you to see it. And so I just want to remind you, you just need to email me or Kelsey, and we will get you on the list for that. So Gary, would you like to close for us?
Yeah, just thank you everybody again for tuning in and staying with us over this more than 1 year period of time. We greatly appreciate it. Thank you for your excellent questions and continuing to support us. Please get out there and get vaccinated. I certainly understand and respect and support, if you have personal reasons where you don't want to be vaccinated, but I just strongly would encourage it. We're seeing, very positive outcomes of it, and I think it's really helping us, move through the tiers and protect our community members. And so I'm delighted to see that the county, just today, I don't know if they went rogue, because I didn't hear anything from the governor moving it to 50 and above, but certainly glad to see that happen. So encourage that of everybody, and I just hope you have a safe and restful weekend. Thank you for continuing to follow all the recommendations and to keep you and your loved ones healthy. And I don't think we'll see you before Easter Sunday, so I just want to wish everybody a blessed and happy Easter, and wonderful to see this beautiful weather. And we definitely will do more gathering with families, but again, let's try to do it in a safe and responsible way. So have a great Thursday, and we'll see you soon.